The health benefits of COVID-19 vaccines are trumpeted the world over. Are their claims correct? Or is there a hidden side to such claims? To find out, see our YouTube channel at RealView Report and subscribe for more interesting videos. (5.3.6) Cumulative Analysis of Post-Authorization Adverse Event Reports of PF 07302048, BNT 162b2, received through the 28th of February 2021. This is the name of the document submitted by Pfizer BioNTech as part of its Biological License Application, BLA, to the U.S. Federal Drug Administration, FDA. It details the adverse events reported for the period, the 1st of December 2020, and through the 28th of February 2021 after Pfizer received the first temporary authorization for emergency supply worldwide, page 6, of its mRNA-based COVID-19 vaccine, Comirnaty. In the document, the adverse events are given in the appendix. Appendix 1. List of adverse events of special interest, pp. 30-38. It lists 9 pages of adverse events or the secret health benefits of the vaccine. On page 6, they say that any adverse event, AE, does not indicate that it was caused by the drug, but by underlying disease in the vaccine receiver or other factors. Apart from the list of adverse events of special interest, the document also lists important identified risks, important potential risks, and areas of important missing information, and vaccine administration errors, whether or not associated with an adverse event. Since this is an mRNA vaccine, let's see how the other viral vector vaccine fare. Oxford AstraZeneca COVID-19 vaccine study is titled, Post-Approval Follow-up for the COV001 and 002 trials, to determine the long-term safety and character of immunological response to the ChAdOx1 nCoV-19 coronavirus vaccine. On page 26, they have defined adverse event, AE, as a medical occurrence which is not caused by or related to taking the vaccine. And, among the serious adverse event, SAE, death, is given as the highest adverse event. For those who want to know the adverse events which are not caused by or related to this vaccine can go through the report. And when adverse events of both types are compared, mRNA-based vaccines are found to be more dangerous than viral vector vaccines. One, these studies are totally unscientific. Since science involves arriving at conclusions based on evidence, these so-called pharma companies and academic institutions have already predetermined the conclusion that any adverse events, AE, that occurs following immunization are not due to the vaccines. Still, the governments encourage people to trust science, or rather pseudoscience or propaganda. Despite this, public trust in scientists drop. 2. Liability. Any rational person, who knows nothing of medical science, when presented with the benefits and consequences of taking vaccines will certainly say no upon doing a cost-benefit analysis. Here, the costs are way more than the purported benefits of protection from COVID-19. The United States' Food and Drug Administration, FDA, had previously gave the Emergency Use Authorization, EUA, for Pfizer vaccine, and is yet to be approved or licensed by it. And, in case you experience severe side effects after getting a COVID vaccine, lawyers say that there is basically no one to blame in a U.S. court of law. The federal government has granted companies like Pfizer and Moderna immunity from liability if something unintentionally goes wrong with their vaccines. They are protected from liability till October 2024. You cannot also sue the FDA for approving or disapproving a drug, as it is part of its sovereign immunity. This means that the state can kill people without getting punished. It is interesting that there is no sovereign responsibility to balance sovereign immunity. Given these, it is high time that peoples of the world sit together and decide whether this deceptive killing of people by the world rulers through their agents should be allowed to continue or not. Otherwise, people are going to die a dog's death by trusting the science, scientists, and governments.